British Columbia's frontline healthcare workers have been raising the alarm about increasing violence on the job.
Pushing, shoving, hitting of our physicians.
Sharing disturbing details in one-on-one interviews.
The patient came out wielding a machete.
And at public rallies.
Punched me in the head over and over and over again. It gave me a bleed in my brain, a severe concussion, and my nursing career is over.
CTV News tried to find out just how many charges there have been for assaults on healthcare workers and how many convictions. After a Freedom of Information request found 0 results, we eventually discovered the justice system doesn't keep track at all.
I think that it's important that we are able to have data so that we can actually understand how big of a problem violence in healthcare is.
The BC Prosecution Service says it's worthwhile to get those numbers, but it doesn't have the budget to update its technology. The Attorney General's office says it's up to the federal government for any changes to recognize healthcare workers as an identifiable victim group.
Let's be committed to making important changes that need to take place in healthcare systems to make it safer, not only for nurses and other healthcare workers providing the care, but also the patients.
In 2022, the province announced it would be hiring and training more than 300 relational security officers for hospitals, but the Conservatives claim they can't detain anyone.
They are not actually licensed to deal with the type of violence and the weapons that are actually coming into hospitals.
The opposition critic for public safety just returned from Alberta after meeting with their minister, who has a different approach.
Not every hospital, but in those high-risk hospitals, they actually employ peace officers. So they have the higher level of training, and they do have the ability to intervene in violent situations.
In a statement, the health minister says the hiring of 781 security personnel has reduced incidents and is now looking into weapons detection with artificial intelligence technology to keep staff and patients safe. Penny Daflos, CTV News, Vancouver.